Dr. Manveer Singh Walia, Chief of the Medical Staff Dr. Prashant Hegde, and all the doctors who are present here today for the CME and GMC Hospital's Doctors Meet 2013. We welcome you wholeheartedly to this meeting tonight. Verily, we are here with the grace of Almighty Allah, the most beneficent and merciful. But we would be starting today's program informally. We would start formally once our chief guest, His Excellency Sheikh Dr. Majid bin Saeed Al Naimi would arrive. So presently we would be starting up right away with the CME. May I request Chief of the Medical Staff, GMC Hospital, Dr. Prashant Hegde to kindly come on stage to introduce the 6 doctors, the 6 speakers for today's CME. Dr. Prashant, thank you.
Introduction rightly said, we have the CME, 6 CME talks for today. Start with the first presentation. Great pleasure introducing my senior colleague who is a senior consultant physician with us, Dr. Mahir Khalil Jallo. He has done his MBBS from University of Mosul. He completed his MD from Arab Board before joining GMC Medical University of Medical College Hospital and Research Center in 2004. Dr. Jallo had worked as consultant endocrinologist in Ibn Sina Teaching Hospital and Al-Wafa Diabetic and Endocrine Center in Iraq. An MOH affiliated consultant, Department of Medicine, College of Medicine and Department of Clinical Pharmacy, College of Pharmacy, University of Mosul, Iraq. Dr. Jallo is an active researcher, investigator in many national and international clinical studies, member of many national and international organizations and societies. He is the head of scientific committee of annual GMU Regional Conference on Diabetes and Endocrinology of Northern Emirates in UAE. Formerly, he is the editor-in-chief of Diabetes Digest from Iraq, the quarterly specialized periodical for the diabetic care providers in Iraq. Dr. Jallo has organized, supervised, delivered more than 35 clinical symposiums and courses during the last 10 years.
Kidney disease, sexual dysfunction, and the nerve damage. As the population age, there is more tendency to develop diabetes. In addition to urbanization, shift from the agricultural to an urban lifestyle means decrease in the physical activity. This is so common going to fitness, using the escalator, and also the portion size, which is over 50 years, you can see the difference, and the shape of the things to come, that the thing which is happening in millions of years totally disturbed in the last 30 or 50 years. So there is evidence of the problem of diabetes, and there is lack of behavior, how we can facilitate the translating sign to better outcome. It is very important to know that in diabetes, we need polypharmacy. This is to decrease glucose dependent insulin secretion, also decrease glucose production, and increase the urinary excretion. And those also we have the 3 agents a must in every diabetic patient, because statin is very important to any diabetic patient. A clever attempt from the before inhibitors is the saxagliptin, which is the name is onigliza, coming in 2.5 and 5 milligram, and modify the dose in renal failure, and still it is a new medication, and it is not licensed to be given with insulin therapy. Take care in patients with renal failure. The most of the DP4 inhibitors except linagliptin need to decrease the dose, and also keep an eye on pancreatitis and abdominal pain in patients using. Just in April, a new medical injection, once daily, twice daily, once weekly. We need to discuss every aspect of medicine.
In Kanpur in 1997, with Chancellor's Award for securing the first position in the MBBS batch. He got his post-graduation from the prestigious AEM Hospital Mumbai from India in 2001. They had immense clinical exposure in all fields of internal medicine. worked in various prestigious institutes in India. This includes CMC Christian Medical College, Vellore, Sanjay Gandhi Postgraduate Institute, Lucknow, Swami Mansingh Medical College, Jaipur, and IKDRC, Ahmedabad. He underwent rigorous training in all fields of nephrology, including hemodialysis, peritoneal dialysis, and renal transplant. He did his postdoctoral DNB in nephrology from the prestigious institute in Gujarat, known for high quality care. He was working as a consultant nephrologist in Kanpur before he joined our institute. Today we will be talking about chronic kidney disease and diabetes
in our society, and it is main cause of chronic kidney disease is diabetes. Like Dr. Malik told, it's an epidemic which is affecting most of all the society. It's not only the affluent society, but the lower level society also. So there has been a recent change in the terminology in AI. Diabetic nephropathy is now known as DKD, that is diabetic kidney disease, and the old terminology which are persisting is ESRD and RRD, that is of the ESRD population. This is USRDS data, which is American data. Now we have recently unpublished data from India also, and there is a trial, SEEK trial, which has been conducted in India in various institutes, and diabetes as a cause of ESRD is almost 33% in India. This again shows that diabetes is the leading cause of ESRD, followed by hypertension, glomerular disease, and then cystic disease.
Chairman Hospital Ajman, to the dais for honoring today's speakers for the CME and the referral doctors. We would like to have the welcome. As I said, we are going to start the program formally now, but before that, we would have the recitation of the holy verses. May I request Mr. Hanif to
بسم الله الرحمن الرحيم إذا جاء نصر الله والفتح ورأيت الناس يدخلون في دين الله.
Mr. Tumbe Akbar Muhyiddin to kindly come on stage for the welcome address.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's an honor to stand in front of you all. Firstly, I would like to welcome His Excellency Dr. Sheikh Majid bin Said Al Nuaimi, who has taken his time. Mr. Tumbe Muhyiddin and my father, thank you very much for being with us. We welcome you today. I would also like to welcome our Provost, Professor Geeta Ashokraj, Dr. Manveer, Medical Director, GMC Hospitals, Dr. Prashant, Chief of Medical Staff of GMC Hospital Ajman. Welcome you all, sir. The speakers of this function, I would like to specially welcome all of you, my colleagues, my family members, but most of all, I would like to welcome each and every doctor who have taken time out on a Friday from all over UAE. Our numbers today have gone almost up to 1,000 years. So we welcome each and every one of you to the annual GMC Hospital Doctors Meet 2014. Welcome. On the outset, I would like to inform you that as you see, the size is increased. I hope we'll be able to cater to the larger numbers, inshallah, next year as well. Or we have to find a better, bigger field. Alhamdulillah, GMC Hospital has had its humble beginnings in 2002. Today, after 10 years, we currently are operating GMC Hospital Ajman, GMC Hospital Fujairah, and GMC Medical Dental Center Sharjah. and are now one of the leading private healthcare providers in the country. As per our President's vision, we aim to open GMC Hospital Dubai as well as GMC Hospital Ras Al Khaimah in this year, inshallah. Our plans, inshallah, in the coming 5 years are to operate 1,000 beds in UAE alone, making us maybe, inshallah, one of the largest, if not the largest private healthcare provider in UAE. We have our international plans as well. Today, I would like to mention that our success, a great deal is contributed by all the doctors sitting here today. So we would like to first of all thank you for that. And second of all, I'd like to mention that we have this event every year so that we can understand, interact better with you, and maybe think of areas of cooperation. So we welcome all your suggestions. You can always come and talk to us with your suggestions and ideas. Once again, I take this opportunity to welcome each and every one of you. Thank you for being here.
Thank you, sir. The first lucky figure for today is Dr. Yusra Sadala. Dr. Yusra Sadala, congratulations, you have won a ticket to Istanbul. A ticket to Istanbul for a couple. Dr. Yusra, kindly come on stage. We're going to pick the second lucky winner. Second lucky winner is Mazen Iman Abdul Rahman, who has won iPad 2.
Cases, one is 500 to 600 women carrying the pregnancy. As I told in the beginning, it is a dilemma both for making an appropriate diagnosis, both for making an appropriate management plan. So as clinicians, we are at a confusion when we are not able to exactly reach at a diagnosis. So we may have to give several differential diagnoses in mind when a woman with acute abdomen in pregnancy presents to us. As far as the first category is concerned, I am not going into the whole list, it's a huge list. So any intra-abdominal organ can pose an acute abdominal condition causing acute abdomen in pregnancy, out of which the most common one being the acute appendicitis we come across. It could be the ovarian cyst rupture, it could be an head neck cell mass, and the other whole list which I have put it there is of a rare.
People also hate us as symbols of pride. About our hospitals, we have got hospitals in Ajman, Fujairah, Sharjah and Dubai is coming up. About Ajman Hospital, it was opened on 17th of October 2002 by His Highness Sheikh Humaid bin Rashid Al Nuaimi, and with our founder president, Mr. Sunday Mohiddin, we find a photograph of Mr. Ahmed Haji Mohiddin, chairman of Beer Group. He's the father of a president. The departments of the hospital, we have got more than 20 departments in the hospital. Accident and emergency works 24/7, and we have got more than 8 to 9 doctors over there. Anesthesia, again, we have got more than 8 doctors, and it is headed by Dr. Raji. And besides giving the normal anesthesia, the department also undertakes ICU care and wellness visits. Cardiology is headed by Dr. Ehab. The department not only does the normal, it's a non-invasive cardiology department, and it specializes in doing echocardiography for neonates also, which is one of the rare things which happens. Clinical lab is headed by Dr. P.K. Menon, and under his leadership and guidance, we are going to move leaps and bounds. Clinical nutrition is headed by Famida, and cosmetology, dermatology and venereology is headed by Dr. Irene, and we have got Dr. Vissam and Dr. Nirmala with us. And besides the medical part of it, we do the other cosmetic procedures such as chemical peels, hair removals, etc. Gastroenterology, dental surgery is headed by Dr. Nabi. We have got 15 chairs, dental chairs in our hospital, and we have got all specialties that include orthodontics, periodontics, complementary medicine. We have got Dr. Ahmad Farooq with us. Our NSC is dermatology, ENT, general surgery, internal medicine, obstetrics and gynecology, ophthalmology, pediatrics and neonatology and psychiatry. Sharjah, we have got a division.
The elderly people, patient known or suspected malabsorption, patient with osteoporosis or osteopenia, chronic kidney disease patient, chronic liver disease patient, patient with known specific musculoskeletal pain, patient with medication that induce B45 enzyme activity, obese patient or homebound or specialized patient. If we are talking for the old rule of vitamin, we are talking about the skeletal aspect. And the old and new one is the rickets. Rickets, as you know, in the ground child mental age different, they are very manifested with deformity of their weight bearing, the widening of the forearm and body. It's also reflected the relation between vitamin D and asthma morbidity. So wherein
for both the patients and the medical staff. And in general, I am going to talk about what are hemorrhoids and some recent advances in medicine, and I will treat in this case, and after that we have a couple of video clips regarding the recent advances in treatment of this condition. Now, the definition of hemorrhoids, mainly they are dilated venous sinusoids and the anal area. Are they present normally or they are pathologically? The answer is yes and no. They are present normally, aiding in some problems in treatment of this condition. Number one, the privacy of the problem, especially this part of the world, and because of the embarrassing symptoms and the privacy of the problem, so the patient will attend late, especially public disease. Number two, the patient have a nightmare each night, especially the sufferer from this problem, because of the fear of the painful and complicated surgical procedure, which means post-operative pain. Number three, what's the most difficult, is lack the knowledge. The patient have abnormal concept and abnormal knowledge about this condition. Now, we have to realize that there are different diseases, many diseases affecting the anal area rather than the hemorrhoids. It's not only hemorrhoids present in the anal area. There is an abnormal belief that all diseases in the anal region referred as hemorrhoids. This is not true. The truth is, it can be anal fistula, abscess, fistula, or anal tumor. The other important facts, the hemorrhoids are mainly presented with rectal bleeding and minimal discomfort. But if there is symptoms, this means that there is a complication like thrombosis or strangulation or prolapse. or there is an additional pathology or other pathology like fissure, fistula or abscess.
Will know which drug will be effective, what dosage will be effective, and what diseases could he suffer from. So today's talk is of something like future science. This slide animation actually tells you how DNA is amplified. So when you heat the DNA strands which are double stranded separate. These separated DNA strands are now annealed by synthetic primers, and these primers are then extended, and following extension from one copy of DNA you land up with 2 copies of DNA. And when you do the cycle about 30 times, you get about 1 million copies of DNA, and that is what is the PCR reaction. This is a classical example of the first PCR which I worked with, where we were able to detect septicemia in children, in pediatric neonates who presented with septicemia by just doing a simple PCR reaction, and we could give the diagnosis within 8 hours. Leptospirosis, another infectious disease. This case was used to detect leptospirosis in a patient with hepatitis B, and leptospirosis was cured by a simple injection of penicillin D. Methicillin-resistant Staph aureus is a big problem for hospitals, and you can easily detect within a couple of hours if a patient is a carrier for MRSA or not. You can see the MECI and the FEMI. The next set of PCRs involves something called real-time PCR, and we use it for HIV, HCV, and HPV viral load as well as minimal residual disease detection. You can see the PCRs occurring, and each colored chain actually shows you the ability to amplify and quantify the reaction. This helps you give appropriate therapy by giving correct antiviral drug and monitoring it for emergence of early resistance. This is another very interesting application of the real-time PCR, wherein you are looking at mutation detection using a PCR. And
Gentlemen, for all those who are present here, we have, as we had said in the beginning, that we have had 10 consolation prizes. But before that, we're going to announce one winner for the raffle draw. This is for our GMC doctors. I would like to thank all those who have made it to the event tonight, especially those who are still staying with us. And I would also like to thank the sponsors, Alabraj Vitabiotics,